in a solo crash. The police catches up to York and Ledyard. In East Lyme, a list of projects that local officials want to fund with a small portion of the $2.7 million in federal COVID relief funds is coming to the town. It's making its way through official channels again. The Board of Selectmen resubmitted to the Board of Finance a $280,000 funding request after the Finance Board failed to act on it the first time around. One of the projects, a new roof for a city building. In Stonington, residents at a town meeting vote 71-36 to approve a tax break agreement with a Boston firm seeking to develop the former Campbell Grain site in downtown Pawcatuck into 82 apartments. The town says the proposed fixed assessment would save Wind Development $690,000 in taxes over 10 years. During that time, Wind would pay $695,000 in taxes to the town. If the parcel remains vacant and undeveloped, it would generate less than $30,000 in taxes over the same period, officials say. Rhode Island health officials have recommended reopening a popular state beach for swimming, but 6 other beaches remain off limits to bathers because of high bacteria counts. They say swimming can safely resume at Scarborough State Beach South in Narragansett. Scarborough was among 7 beaches where swimming was discouraged starting last Friday after 2 days of heavy rain raised bacteria levels.
Managing Director of Paragon Trust Company and tax and private client practitioner, joins us to bring a common sense approach to money in a world of total insanity. Let's welcome Tony D'Angelo.
All right, my pal Tony D is joining us, and as I stated earlier on this morning, Tony, I'm going to keep you up late tonight. I got you calling in to join me tonight on the Wayne Allen Root Show, so I thank you for that. I'm looking forward to what we're going to talk about tonight as well, but today, I started out today, Tony, talking about China and the devils and the deviousness that has gone on since the beginning of this Wuhan flu and the criminals that are over in China. And you want to sort of talk about that in a
Well, yeah, and, you know, we've had our lives really severely altered in the past 18 months. We've taken things without question. We've believed what a multi-million-dollar spin machine has told us. And first of all, good morning, and good morning, Lee Elci, and good morning to the kids, and proud to be among everybody. But I want to mention something good, and that may sound somewhat unusual.
What?
But I had such an outpouring of people coming to me last week about the youth crime and talking about that. And I made a statement. I'm glad I made it, but it was a statement in error because it taught me something, where a number of people came to me and said, hey, Tony, we're doing youth groups. We're doing PAL. We're doing this. And it's like, we don't hear about that, Lee Elci. We hear about youth crime. We hear about these terrible things. And that really touched me, you know, because there's a lot of good things happening there. Now, other than giving this just honorable mention, saying, hey, guys, that's great, wonderful, whatever, I thought, well, you know, D'Angelo, put your mouth where your money is. And if this is what's going on, when we look at this really, and again, all the damage that was assailed to us starting from China, there's people like me, there's people who are like at the stage of our lives that we are, and there's people in these youth groups. These groups right now are really, I hate to say it, but they're really kind of like our last hope. Because, you know, we've got an entirely failed political system. We'll talk about that in a few minutes. I mean, it's, you know, unspeakable. Education, I mean, what education? I mean, it's like beyond belief. These people in these groups, to me, touch my heart. And I'm thinking, hey, a lot of us older guys and women should dialogue with the people in these groups and, like, what can we do to, like, you know, can we introduce, you know, education and socialization and awards and achievement and things like that, you know. And I've got an open invitation here for anybody that wants to come to me and some of you older guys and girls, and it's like, I think we need to dialogue because we have this whole generation right now that's going to be lost, living under the fear inspector, say that 5 times fast, D'Angelo, of COVID-19. And, you know, we've got the seeds of hope here, and, you know, I want to have a dialogue. Let me just say this. When I left heaven, I missed the paint shed. I am the color that I am. So this is really a chance to say, you know, people that are not of color can teach people of color, and people that are of color can teach people who are not of color, and it's a great opportunity to learn, and we're sitting right at that precipice.
You know, I don't mean to interrupt you, but I got to add, I get the same response too when we were talking about this last, talking about how there's nothing for the kids to do and there's nothing going on. A bunch of people reached out to me too, Tony. I forgot to tell you about that. They said, "Oh no, we're doing this and we're doing that, and this police league does this and this." So good for them that they're still out there doing stuff.
Yeah, and thank you for shutting my fat mouth, because now you've made it on me, and I'm putting a call because we got some great older kids here who know a lot and know a lot of things. What will be their legacy? I mean, guys, we need to show these people how to live, because this world is not going to get any better. I mean, in that regard, do not count on your government to help you.
No.
And I wasn't raised an anarchist, just so you know. I was going to vote for Richard Nixon in 1972, but I missed him by a year.
All right, well, there we go. So where are we going to move?
Yeah, I know. Hey, what are we going to do for an encore? Well, let's talk about, what's actually happening. Now, of course, we talk about this whole thing of racism being a public health crisis, and this is kind of a departure for me again, because I listen to what people were saying. I listen to what the concept of the bill is. Marvin was kind to show me what the Norwich City Council was doing, which is really kind of a different sort of offshoot from what the state legislature actually did. But you know me, I got to get back to the roots of the thing. The racism is a public health crisis legislation, which is Senate Bill 1, if you're keeping score at home, on June 14th. It is not titled as such a racism as a public health crisis bill, but it's actually measuring the effects of COVID-19 on society. Remember, we talked about in September how if the Democrat Party was going to be elected, they would make COVID a lifestyle. Well, guess what? This is what we're living. And, again, this is why we need $72 million a spend to tell us something else other than what's taken place. In the study of your tax dollars at work, we're going to look at, the obfuscation and bifurcation of lawmaking in the state. And when it comes down to, when you actually start to get into the meat of the bill, the first thing they tell you is that this is something with the funding. We're going to have funding for something called Health Equity Solutions, which is a state-funded nonprofit. And this is since 2015. So they're allocating, hundreds of thousands of dollars to that. And the solution in the bill, of course, in Connecticut, it's always a bureaucracy. It's bureaucrat after bureaucrat after bureaucrat. And if you want to solve a problem with bureaucrats, guess what? You have another bureaucrat happening. And this is how you do things. Now, again, we're talking about what people think of this as something with sensitivity in healthcare. There's 4 distinct committees in this bill. There is a commission on racial equity. There is a commission on gun violence reduction strategies. The effect of gun violence is healthcare, but I don't think sensitivity in healthcare is going to have anything to do with gun violence or reducing it. A maternal mortality review committee and a peer support services panel. I could just go on and on and on and on. But basically what it comes down to is this is empowering a panel in the state government, and they have access to all data. They have access to everything that's out there. Think of your data security. Nobody really seems to give much of a thought about that anymore. And, it is not the quote-unquote sensitivity in healthcare thing. It is something which is really advancing a particular agenda, and that's very clear. One of the things that's there, and this one really got me because you and I were chatting about it earlier, in this bill, we talk about the impact on the zoning as it sits right now in Connecticut on public health. I thought, well, hey, that's great. I'm here in Pomfret. My closest hospital is 8 miles away. It's it's a choice. It's where I live,
right.
and that's just the way it is. Now, if I'm in a city, a hospital is maybe within walking distance or something like that. I mean, there is nothing here but the advancement of a particular agenda. And one thing, I'll just mention this because I know you've got a ton of questions on this. There is something here called, which is in this bill, known as cultural humility, What is cultural humility? Well, it acknowledges three, reading from the bill, okay, an acknowledgement of one's inferiority as to who they are. In other words, be ashamed for being a white guy, D'Angelo. Not that I have anything that I could really do about that. It is a recognition of an uneven playing field. And it is, quote unquote, an obligation to submit to advocacy groups who are going to tell me what to do. This is the opposite of something where we were all told what was the right thing to do, which is cultural competence. Lee Elci, you are a Caucasian man. You have teammates of color. You relate to who you are. You are secure in your own being. We can't do this anymore. Now, this is, if you're going to get, quote unquote, health sensitivity out of this stuff, I suppose you can look for it, but there's a whole lot more Cracker Jacks in this box than what we're looking at. Your ball, my friend.
I was thinking about this the other day, for a long time, and I was thinking maybe we're looking at this from a different or a wrong perspective. Maybe they're right, Tony. And again, I'm being a little facetious here. Maybe there is systemic racism throughout the system. Maybe it's embedded in everything that we do every single day, including the healthcare institutions. And if so, if it were the case, right, the Democrats have controlled this state in particular for as long as I've been alive, right? The legislature has been in control of everything from as long as I've been here.
I go back to the days of John Dempsey.
So if it's systemically racist, then it's become systemically racist because of things that the Democrats have done. So it's their doing as to why we're here right now. I know that maybe is a far-fetched idea, but if they're going to be... See, I think the Democrats have this way of, when they know they've done things wrong in the past, and they know America and Connecticut residents have short memories. So what they do is they jump on the side that's the most popular. Everyone's talking about this systemic racism. Let's go hammer the Republicans because it's got to be their fault. That blah blah blah, and they let everybody forgets that really they're the cause for whatever it is that people are claiming ails them. Does that make any sense?
Perfectly. And the thing is, it's always another committee. It's always something different legislatively. Republican politicians come on your show and they talk about the cost of things. Well, guys, where were you when the lights went out? Did I ever see you say one thing about reducing the overdue interest pay or the overdue interest rate on state taxes during the 2009 class? No, not a word. We can't touch revenue. So it's like really all people here, Lee Elci, have sinned and fallen short of the glory. But it's like, it's we're just going to throw more money at something and expect a different result. It makes absolutely no sense. We don't deal with root causes. Let me just mention this much, that there is a large subcommittee under this bill to deal with, teen birth. Is there anything at all to deal with fatherlessness? D'Angelo, go dream somewhere else.
Right.
We don't deal with root causes. We just keep papering over things. We just keep having more committees. We just keep throwing things. And then we have legislators come on the show saying, well, I voted for this because that was in the bill. I really wasn't sure of the other stuff. Come on.
Totally agree. And listen, to me, and the way they formulate these bills, they should be one-off bills. They shouldn't be, piled with so much garbage in these things. That's a whole different story that we can talk about. But
oh yeah, for sure.
I don't want to come across with my last statement as saying I believe there's systemic racism in the system, or I believe that because basically what that's saying, and this is what I can't get around, in particular with what Norwich was doing and sort of how you dove into this thing is that by saying that folks of color get let's say subpar treatment, you're saying that the people who are working behind the desk, or the doctor or the nurse or the other folks who are reading the dials and pushing the buttons, they're looking at somebody because of the color of their skin and they're giving them subpar care. I don't get how that they can actually come to that conclusion.
But maybe I'll go you one better here. If that exists, and I'm not going to say it doesn't exist, I'm not really sure of every single interaction that takes place in this great state of ours during a day. Is the issue racism, or is it professionalism? Is it empathy? Is it communication? Is it sensitivity? That transcends all color. We don't talk about that because
Right.
all of those things speak to personal responsibility.
Totally agree.
No, we don't do that because if we don't have that, then our government can't dictate to us.
Right. No, I agree. And they don't factor in sort of even the personality of the person who's coming in there. Like if I were to go in to a doctor's office and act like a jackass, Tony, then I would think that my care is going to be less than a person who goes in there with respect and does the right thing and acts like a regular human being. I think that there's certain, not that I'm saying that anybody's doing that, but I'm saying they're forgetting all these other different factors. There's also a lot of financial factors that go into some of this stuff as well that seems to be forgotten. If that makes any sense.
Well, yeah, and the thing is, people normally, the thing is, we're told now that we have to formulate opinions of people, kind of just because of who they are, like they had anything to do with the color of their skin.
Right.
But people don't formulate opinions, Lee Elci, immediately upon seeing somebody. They formulate an opinion on a first impression, which they told us for years and years and years. You never have a second chance to make a great first impression.
That's exactly right. You're exactly right. All right,
Well,
listen.
that just as difficult. Hey, my seventh grade educated father gets wiser every day.
Well, listen, it was good talking to you now. I'll talk to you in, let's say, 13 hours?
Rocket, my friend.
All right, man. Thank you, Tony D. Again, breaking that down for us, always a pleasure. If you don't get enough Tony D with us here, get some more tonight. I'll have him on at 8 o'clock as I fill in for Wayne Allen Root. Very quick.